Hey everyone, and welcome back to the deep dive. I think we can all agree that we see patients over 45 every day in our practices, and they are just grappling with this whole presbyopia thing.
Yeah,
Tired of readers,
yeah,
and I get it,
totally.
but the good news is that we're in a really interesting time right now with presbyopia treatment because we're seeing this emergence of all these new treatment
Or
options.
for sure.
So that's what we're going to dive into today.
Yeah.
Vuity, the first FDA-approved presbyopia eye drop.
It's a game changer.
It is, and it's definitely got everybody talking. I feel like it's all over social media. All the patients are coming in asking about it.
Right.
So we need to make sure we're all up to speed so we can, keep our patients informed.
Exactly. And that's exactly what we're going to do in this deep dive so that you can confidently talk to your patients about Vuity and all the other upcoming treatments. We'll cover how well it works, who are the best patients for it, what are the potential side effects, and then, how it's actually being used out there in the real world.
Yeah, I think that's a really important point, that distinction between, like, the clinical trial data and then what we're actually seeing in our patients, because sometimes it's not quite the same.
Absolutely.
And then we'll even look ahead, like what's coming down the pipeline in the future, because
Mhm.
this is really just the beginning.
Oh, it is.
All right. So let's start with the star of the show, Vuity, the first FDA-approved presbyopia drop. How does this thing work? It seems kind of like magic.
Well, Vuity, otherwise known as pilocarpine hydrochloride ophthalmic solution, 1.25% is what we call a miotic. And what that means is it works by constricting the pupil.
Okay.
So it's basically like creating a pinhole effect.
Ah, okay.
And this temporarily increases that depth of focus, so it allows your patients to see those near objects more clearly.
So simple yet so brilliant.
Well,
But is it the answer for everybody who's struggling with presbyopia? Is this like the magic bullet?
well, that's the real question, right? Because it's a really powerful tool. But like any tool, it's not one size fits all.
Right, right. You got to know which tool to use for which job.
Exactly.
So how do we figure out who are the best candidates for Vuity? What are the things we should be looking for?
Well, motivation is key.
Okay.
The patients that do the best with Vuity are the ones who are like, I don't want to wear these readers. I want to do anything to get rid of them.
Yeah, they're coming in like shaking their fist at their reading glasses.
Exactly.
Yeah.
And they usually have specific things that they want to do without their glasses, checking their phone, reading a menu, working on the computer.
Yeah, yeah. So if somebody is only mildly bothered by their presbyopia, they might not want to deal with any even minor side effects or the cost.
Exactly. And then another really important factor is the stage of presbyopia.
Okay.
Patients that are earlier in their presbyopia journey tend to respond better.
So what do we mean by earlier in their journey?
Basically, it means they still have some of that accommodative reserve.
Okay. I mean,
So accommodative reserve is basically the amount of focusing power the eye has left.
okay.
As we age, the lens in our eyes gets less flexible, so that reserve just dwindles away.
Yeah.
And Vuity works best when there's still some of that reserve to tap into.
Oh.
So it's kind of like giving their eyes a little boost,
So not replacing lost accommodation, but sort of enhancing what's still there.
Exactly, exactly. And then there's another group of patients that seem to really love Vuity, and those are emmetropes.
Emmetropes, okay.
So these are the patients that have never needed glasses for distance.
Right.
And so when presbyopia hits, they're like, wait, I've never had to wear glasses before. This is
Yeah.
terrible.
Yeah, like their perfect vision world is suddenly shattered.
Exactly. And for them, Vuity can be a real game changer.
I can see that.
I mean, in one of the articles we were looking at, there's a case study about this 47-year-old administrative assistant, and she just hated having to put on and take off her readers all day.
Yeah.
And she started Vuity, and she was able to get rid of her readers completely.
Wow.
She was so happy.
That's awesome.
So yeah, it can really make a big difference in people's lives.
Yeah, and it's a good reminder that it's not just about the refractive error, it's about quality of life.
Exactly.
But before we go too far down that road of like all the wonderful things about Vuity, we need to make sure we're doing our due diligence.
Oh, yeah.
We need to be talking about a thorough eye exam and some things to be thinking about before we just go prescribing this to everyone who walks in the door asking for it.
Exactly. And, patient safety always comes first, right?
Always.
We need to remember that pilocarpine, the active ingredient in Vuity, it actually contracts the ciliary body.
Okay.
And this contraction can pull on the retina.
Oh, Oh,
which could lead to some problems.
so this is more than just like, oh, you might get a little headache.
Right, and there actually have been some reports of retinal detachments or vitreofoveal traction
Wow.
associated with this pilocarpine 1.25% use.
Okay.
It's not super common,
Yeah.
but it's a risk that we need to be aware of.
Right. Absolutely.
So before you even think about prescribing Vuity to a patient, we need to make sure they have a complete eye exam, including an OCT of the macula.
Okay, so that's like step one, full workup before we even consider it.
Yes, definitely.
Are there any patients that we need to be extra careful with?
For sure. So patients with high myopia, we've got to be really careful with those guys.
Okay.
They're already at a higher risk for retinal detachment.
Right.
And so Vuity could make that risk even worse.
Yeah, we don't want to add fuel to that fire.
Exactly. We also need to be careful with patients who have risk factors for things like iridocyclitis or uveitis,
Okay.
because pilocarpine can actually promote inflammation. And that could be bad news for these patients. And then, of course, narrow angles.
Oh, yeah, of course.
Pilocarpine can make those angles even narrower.
We all learned that in optometry school.
Right.
There's almost like a pre-flight checklist.
Yeah.
Like make sure everything is good to go before we clear them for Vuity.
Exactly.
But just as important as that initial workup and being careful about who we prescribe it to is patient education.
Absolutely.
Because even if they're a good candidate, we need to make sure they know what they're getting into.
For sure.
Yeah.
We need to be really upfront with our patients about the potential for side effects and what to expect.
Yeah.
It's all about open and honest communication.
I like that. So let's talk about side effects.
Okay.
Our sources say that for most patients, they're fairly mild, but we still got to be prepared.
Right.
So what are we looking at here? What are patients going to complain about?
So the most common side effect is headache, and specifically a brow ache. And in the Gemini 1 trials, these were the phase 3 trials for Vuity, about 14% of patients experience this kind of headache.
Okay.
Most of them say it's really brief and goes away quickly.
Right.
But, some people do have more persistent pain or, more severe pain.
So it's not your typical, like, tension headache. This is, like, specifically a brow ache.
Yeah, it seems like it's related to that contraction of the ciliary muscle,
Okay.
which is pulling on all the stuff around the eye, including the brow.
Okay. Yeah, so it kind of makes sense. So what do we tell those patients? What's our advice?
Tell them to try the drops for at least a week and see if it gets better.
Okay.
A lot of times, people's bodies just adjust and the headache goes away.
Okay.
But also be upfront with them that over-the-counter pain relievers, they might not help.
Yeah.
So just kind of manage those expectations.
Managing expectations, big theme here with Vuity. What other side effects do we need to prepare them for?
Well, impaired vision in darkness or dim lighting, that's another common one.
Makes sense. If the pupils are constricted, that's going to make it harder to see in the dark.
Exactly. Those pupils have trouble dilating when it's dark.
Yeah, like when you come out of a movie theater.
Yeah.
And it's like blindingly bright outside.
Exactly. And then also we need to let patients know that they might have red eye irritation, maybe some increased tearing, even a little nausea.
Okay.
But again, usually pretty mild.
All right. So those are all things to keep in mind.
Yeah.
Any specific advice on how to manage those side effects?
Well, if they wear contacts, make sure they take them out before putting the drops in and wait like 10 minutes before they put them back in.
Okay.
And then if they're using any other eye drops, tell them to wait 5 minutes between the Vuity and the other medication.
Perfect. So we've covered how it works, who it's good for, potential risks, side effects. But how does it actually perform out there in the real world?
That's the big question, right?
Yeah.
I mean, do the results from those clinical trials match up with what our patients are experiencing?
Yeah.
And to be honest, it's kind of a mixed bag. I mean, some patients are saying, like, this is amazing, I can see so much better. And others are like, I don't really notice a difference.
So again, managing expectations is really important here.
Oh, yeah, absolutely.
It's not going to be a miracle for everyone.
Right.
So the clinical trials showed, I think, that about 30% of patients got a 3-line improvement in their near vision. But that's under ideal conditions.
Right. Those are perfect conditions.
And real life is not always perfect.
Exactly. So we need to be realistic with our patients and tell them, hey, this might not be a complete game changer for you.
Yeah. So 3 lines is like hitting the Vuity jackpot, but what's more realistic?
So most patients can probably expect to improve 2 to 3 lines on the near vision chart.
Okay.
And it's really important to remember that the effect only lasts for 5 or 6 hours.
Okay.
And it works best in the first 3 hours.
So it's a temporary boost.
It is.
Not a permanent fix.
Correct.
We've got to talk about the elephant in the room.
Yeah.
Cost.
Big one.
As we all know, insurance doesn't usually cover this.
That is correct.
So this is an out-of-pocket expense for a lot of people.
It is, and it's around $80 a month.
Yeah.
There is a My Vuity Points program, which can help some patients.
Yeah.
But, I mean, $80 a month, that's a lot of money for some people.
Absolutely.
And we need to be sensitive to that when we're talking to our patients about this.
Absolutely.
You know, we were talking to Dr. Sai, one of the ophthalmologists, and she said a lot of her patients find that, you know, it just doesn't work well enough for the cost.
Sure.
And the side effects.
Yeah.
So they end up just using it every now and then, or they just stick with their readers.
Right. So it's really about, again, shared decision-making with the patient.
Oh, absolutely.
You know, giving them all the information, good, bad, and the ugly.
Yeah.
And then letting them decide if it's right for them.
Totally. It's about finding what works best for each patient.
Exactly. This has been super helpful.
Good.
Before we move on and talk about what the future holds for presbyopia treatment, where can our listeners find more information about Vuity?
So we put a link to that journal article that we've been talking about in the show notes today.
Perfect.
You can check that out for all the details.
And while you're down there, don't forget to hit that follow button for the deep dive so you don't miss any of our upcoming episodes, deep dives.
Yes, please.
And if you're finding this information valuable, we'd really appreciate a 5-star rating.
It really helps other eye care professionals find the show.
Absolutely. And it helps us know that we're doing something right.
Exactly.
So thank you.
Thank you.
All right, now I'm excited to talk about what the future holds for presbyopia treatment, because it sounds like there's a lot to look forward to.
There is.
So stay tuned, because in part 2, we're going to dive into this whole world of emerging presbyopia treatments that are in the pipeline right now.
It's going to be good.
It is. You're not going to want to miss this. We'll see you in part 2.
See you later, Key. Welcome back for part 2 of our deep dive into presbyopia treatments.
All right, so Vuity, very interesting, very promising.
Yeah.
But I get the sense that this is just the tip of the iceberg.
Oh, absolutely.
So much more is coming down the pipeline.
Oh, yeah. The research pipeline is bursting with new ideas for presbyopia.
I'm excited. Tell me more.
Well, you know, Vuity has kind of blown things wide open in terms of pharmaceutical treatments, and we're seeing all these new miotics in development right now.
Okay, so miotics, it sounds like that's kind of the hot area.
It is.
Everyone's trying to perfect that pupil constriction approach.
Yeah, some of them are kind of tweaks to the pilocarpine formula, but some of them are totally different miotic agents altogether.
So what are some of the ones that are like really standing out to you? What should we be keeping our eye on?
Well, there's one called Brimacol PF from Visus Therapeutics, and this one's got people talking.
Brimacol PF?
Yeah, it's a really interesting combination of 2 drugs. You've got carbachol, which is another miotic,
Right.
and then brimonidine tartrate,
Brimonidine.
which is an alpha-2 agonist.
Interesting combo. So it's not just constricting the pupil, but also potentially doing something to that ciliary muscle.
Exactly.
Okay, what's the
Yeah.
thinking there? Why combine those two?
Well, the hope is that by using these 2 mechanisms together,
Yeah.
they can get a more sustained near vision improvement.
Okay, more consistent, longer lasting, that kind of thing.
Exactly. And the early results from the phase 2 trials, they look pretty good.
Promising.
Yeah, patients are seeing some significant gains in their near visual acuity.
Okay, so Brimacol PF, definitely one to watch.
Definitely.
What else is out there?
Okay, so there's another one called CSF1.
CSF1.
This one's from Erasis Pharmaceuticals.
Okay.
And they're taking a slightly different approach.
Okay.
So this one is actually a low-dose pilocarpine formulation.
Oh, interesting. So kind of like Vuity, but maybe a little gentler.
Exactly. The idea is to get those near vision benefits, but with less of the side effects.
Okay, that makes sense. I mean, headaches are definitely a concern with Vuity for some people.
Yeah.
What's the data looking like on this one?
So they've actually already finished the phase 3 trials.
Oh, wow.
And it's looking pretty good.
Okay.
They're showing significant near vision improvement, but less headache and brow ache
Compared to Vuity.
compared to Vuity.
Okay, so better tolerability.
Yeah, which is huge. It's bad.
Absolutely.
Yeah.
Any other miotics that are kind of like breaking the mold a little bit, doing something really innovative or different?
Well, there's Lens Therapeutics,
Okay.
and they're working with these 2 formulations called LNZ100 and LNZ101.
LNZ1, okay, got it.
And these are using a different miotic altogether called aceclidine.
Aceclidine, that's a new one.
It is.
What's special about that?
It seems like aceclidine is really good at targeting the iris sphincter,
Okay.
but it doesn't affect distance vision as much.
Oh, that's really interesting because I feel like one of the concerns, at least that I've heard from other doctors about miotics, is that they can make distance vision a little fuzzy, especially at night.
Right, and it seems like aceclidine might be able to avoid that.
So that would be a big advantage if it works out.
Huge advantage.
So it's all about finding that balance.
Yes.
Improving near vision without messing with distance vision.
Exactly.
What else? What else is out there?
Well, there's another interesting one called Microline,
Microline.
and this one is from Ionovia.
Inovia.
And they're actually using pilocarpine, so it's the same drug as Vuity,
Okay.
but they've got this really unique micromist dispenser.
Oh, so same drug, different delivery system.
Right.
Interesting. So what's the benefit of that?
The thinking is that with this micromist dispenser, they can get really precise dosing,
Okay.
which could lead to better results and fewer side effects.
So it's like, if you're watering your plants, you could use a watering can, or you could use a really high-tech sprinkler system.
Exactly.
Okay. So everyone's trying to find that, like, that little edge,
Yeah.
that little tweak.
That little advantage.
That's going to make their product stand out.
Absolutely.
What else? Anything else that we should be keeping our eye on?
Oh, there's one more. Nixol.
Nixol. Okay.
This one's from Occupire Pharma,
Occupire Pharma.
and this is another combination therapy.
Oh, okay.
So this one pairs phentolamine ophthalmic solution, 0.75% with low-dose pilocarpine.
Okay, so 2 drugs again.
Yeah.
Phentolamine, remind me what that is again.
That's an alpha-1 blocker.
Right, right.
And the thinking here is that this combination is going to make those pupils constrict even more
Oh, interesting.
and really enhance that near vision.
Okay, so they're really kind of experimenting with all these different combinations and formulations
They are.
to kind of fine-tune this whole meiotic approach.
Yeah,
And I feel like, the future is really going to be about personalized medicine,
absolutely.
figuring out which meiotic works best for each individual patient.
Exactly.
So meiotics are kind of like dominating the conversation right now. But there's another approach that's kind of bubbling up that I think could be a real game changer.
There is.
And that's lens softeners.
Lens softeners.
Okay, this is where it gets really interesting for me.
I know, this is exciting stuff.
Tell me more about lens softeners. How do they work? What's the big deal?
Well, the idea with lens softeners is to actually tackle the root cause of presbyopia,
Okay.
which is that hardening of the crystalline lens.
Right, so instead of just trying to work around that stiff lens, they're trying to actually change the lens itself.
Exactly.
Wow, okay, so potentially reversing the aging process within the lens.
Potentially.
That's pretty wild.
It is.
So how do they do that? What's the science behind this?
Well, one of the leading contenders in this area is a drug called UNR844.
UNR842, okay.
Yeah, and it uses 1.5% lipoic acid choline ester.
Lipoic acid, now that sounds familiar.
It is. It's a powerful antioxidant.
Right, I know, it's like a big thing in the anti-aging world.
Yeah.
So how's it working in the eye?
So in UNR844, it seems to work by reducing something called disulfide bonds
Disulfide bonds.
in the lens proteins.
Yeah.
And these disulfide bonds, they tend to increase as we get older, and that makes the lens stiffer.
So it's like breaking down the glue that's making the lens all rigid.
Exactly. That's a good way to put it.
The million-dollar question, does it work?
Well, the early results are promising, but, we need more research.
Yeah.
One study showed good improvement in near vision.
Right.
Then another study, the results weren't as impressive.
Yeah, so it's still kind of early days,
It is early.
but the potential is definitely there.
Oh, it's huge.
If this pans out, it can really change everything about how we approach presbyopia.
Absolutely.
I mean, imagine if we could actually give patients a treatment that not only makes their vision better,
Yeah,
but also slows down the progression of presbyopia.
that would be amazing.
That's a total paradigm shift.
It is. It is.
Okay, but I could see how this is also going to make things a lot more complicated. Because now we've got all these different
There's
options.
so many options.
How do we choose? How do we know what's going to be best for each patient?
You're right. I mean, the future of presbyopia treatment is exciting, but it's also going to be a challenge.
Yeah.
We're going to have to stay on top of the research,
Right.
be ready to adapt, and really take a personalized approach to each patient.
Couldn't agree more. This deep dive has been really eye-opening.
Good.
It feels like I've had a glimpse into the future of presbyopia treatment.
Yeah, it's changing so fast.
Before we wrap things up and move on to our final thoughts, let's just remind everybody where they can find more information about all of this.
Yes. So in the show notes, we have that journal article that we keep mentioning.
Perfect.
If you want all the nitty-gritty details, check that out.
And while you're down there, don't forget to follow the deep dive so you don't miss any of our future deep dives.
Yes, please do that.
And if you're liking what you're hearing and you're finding this information helpful, we'd love for you to leave us a 5-star rating.
Yes, it really helps.
It really helps.
Other eye care professionals find us,
Exactly.
and it lets us know that we're doing a good job.
Absolutely. So thank you.
Thank you for listening.
Okay, so now let's move on to part 3, where we'll kind of wrap up our discussion and talk about what all of these advancements really mean for the future of eye care. All right, so welcome back to the final part of our deep dive into presbyopia treatment. I gotta say, after learning about all these new developments, I'm excited about the future, but I'm also a little overwhelmed. It's a lot to take in.
Oh yeah, I totally get it. It's exciting to see so much innovation happening, but it also makes you realize just how fast things are changing. It can be hard to keep up.
It really is.
Yeah.
It feels like we're at this turning point in how we manage presbyopia. But, with all these new options popping up, it really makes you wonder, what is the future of presbyopia treatment? Like, what's it going to look like?
I know, right? It's like we're trying to look into a crystal ball and figure out how it's all going to play out.
Exactly. So, are miotics going to become the go-to treatment for everybody? Or will those lens softeners prove themselves and kind of steal the show? And then, what about all those surgical options? Corneal inlays, refractive lens exchange? Will we even be doing those anymore if the drops get good enough?
It's interesting to think about how all these approaches might end up working together. Like maybe we'll use miotics for those early cases and then save the lens softeners or surgery for, more advanced presbyopia.
Yeah, or maybe we'll start combining things like miotics and lens softeners together to get even better results. Hit it from all angles.
The possibilities are endless. That's what's so cool about this field. There's always something new to learn and new ways to help our patients.
And that's exactly what this deep dive has shown me, that staying informed and being flexible is so important. We got to be open to these new ideas, embrace these technologies, and be willing to adapt as the research changes.
Couldn't agree more. And that's exactly why we do the deep dive, right? To help eye care professionals like you stay ahead of the curve.
Well said. So we've covered a lot of ground in this deep dive. We went from Vuity, those miotics, to like the super cool stuff like those lens softeners. But before we wrap up, I think it would be helpful to just quickly go over some of the key takeaways.
Yeah, definitely. I think one of the biggest things to remember is that presbyopia treatment isn't one size fits all anymore. We have all these options now, and it's up to us to really figure out what's going to be best for each patient.
Exactly. It's all about personalized medicine. We need to find the right tool for each job and make sure our patients know what's going on so they can be a part of that decision-making process.
And speaking of patients, we can't forget about education. We really need to be open about the good, the bad, and the ugly of each treatment so that our patients can make informed choices.
Totally agree. That open communication builds trust, and trust is key to getting the best results for our patients.
And we also have to remember that, what we know today could be totally different tomorrow.
Oh yeah, research is constantly changing things.
Exactly. This field is moving so fast, it's a constant learning process.
It is, and that's where resources like the deep dive come in.
Exactly. We're here to break down that research for you, find the most important points, and make sure you have the knowledge to provide the best care for your patients.
So hopefully, this deep dive has given everyone a clear picture of where we're at with presbyopia treatment right now. No blurry vision here. And maybe even a glimpse into what's to come.
I think we covered it all. From the little details to the big picture, it's been great chatting with you all today.
And we'd love to hear what you thought of this episode. What were your aha moments? What questions do you still have? Come find us on our website or social media and let us know.
And don't forget to check out the show notes for a link to that journal article and all the other resources we talked about.
And if you enjoyed this deep dive, please do us a favor and leave us a 5-star rating. And tell your colleagues about the deep dive. We're trying to reach as many eye care professionals as we can and make all this complex stuff a little easier to understand.
Thanks for joining us. Keep learning, keep exploring, and we'll see you on the next deep dive.
See you next time.